Hello.
Hi Mel, this is Becky with the Indiana Cancer Care Program. How are you doing?
For Mel Anderson, dealing with pain and depression is now a little easier. Instead of making a special trip to his oncologist, which is sometimes hard to do, Mel is talking to Nurse Becky Saunders about his pain over the phone.
I've been having a little bit of chest pain.
Can you tell me where you're having the pain?
By doing it over the telephone, it made me a lot more comfortable and I could speak what I was actually feeling in my heart.
Typically, pain is often treated in the medical setting as a physical symptom, and depression in the mental health sector, and sometimes this fragments care.
Dr. Kirk Kroenke from the Reagan Strife Institute and Indiana University and co-authors studied more than 400 cancer patients from rural and urban areas across Indiana who had pain, depression, or both for 1 year. Half answered automated questions about their symptoms either by phone or internet and received a monthly follow-up call from a nurse who was part of a nurse-physician specialist team. The others received the usual care from their oncologists.
Patients in the telecare management group were 50% more likely to experience a significant improvement in their pain. And patients with depression, there was a 40% reduction in the number who had major depression at the end of the year.
The study appears in this week's JAMA, Journal of the American Medical Association.
This is a way of enhancing care for all patients and maybe making their visits to a doctor more selective when it's really needed for treatment or tests.
I was concerned because his pain scores had increased.
It's a partnership. After talking with Mel, Becky meets with Dr. Kroenke to formulate a plan, which they will then recommend to his oncologist.
There was days where I would think, it's just overwhelming, and by talking about it, it made it a lot easier for me to accept where I was and how I was feeling.
Catherine Dolf, the JAMA Report.